It's a 10-bedded unit with 2 isolation rooms. It's, as you can see, spacious, airy. It's the delivery of care to level 2 patients. Those are patients who are seriously and critically ill, who require close monitoring, high level of nursing and medical care. The other thing that this does is that we hopefully, by having these patients in a setting whereby they are able to receive high quality care, that we will recognise deteriorations earlier, hopefully avert the need for patients to be transferred to the intensive care unit, or if the patient does need to be transferred to an intensive care unit, we will be more advanced in our plans for transfer at an earlier stage, so making it safer to have patients transferred.
Hi Alison, how are you?
Morning, Charlie.
Morning.
Charlie,
So who's this?
Anya.
Hi Anya.
McFarlane.
Can you hear me okay?
This is Charlie, one of the doctors from
Okay.
Care in Gavin, alright?
Do you mind talking to me through the robot? No, okay. Can I talk to Alison about you for a couple of minutes? Okay. So what's the story here, Alison?
She's a 14-year-old girl. She came in with right iliac ossett pain and epigastric pain. Had her appendix out 2 weeks ago following perforation for that. It was then decided to take her down for a laparotomy, so she's day 1 following that for small bowel obstruction because of adhesion.
Could you just move your head very slightly so I can see the monitor?
Yeah.
Okay. Okay, so all our obs are essentially normal?
Our observations are stable, yeah.
What about yourself, Anya? How are you?
Not too bad.
Are you comfortable? Are you a bit sore?
There's no pain, just over the wound. That's it.
Yeah, just flip that back.
She's on paracetamol regular and she's also on her PCAS.
Okay. Okay, and can I see the fluid balance as well?
Yesterday's fluid balance is so she's on her paediatric fluid balance, so positive 848 mils.
Okay.
Her NG aspirate there was 240 mils in the 24 hours.
And has she had bloods this morning?
She would have her bloods, but they wouldn't be back yet, Charlie, the results.
Okay, when's the last sodium we had?
Yesterday,
And what was that?
141.
Yeah,
And
what fluid is she on at the moment?
She is on Hartman's, going at 80 mils an hour.
Okay, and a sodium's gone off this morning, has it?
Sodium went at 1 o'clock this morning and it was 142, and she'll have a repeat done for the 12 hourly at 2 o'clock this afternoon.
Okay. And is there a catheter in, no?
Yes, she's an audiometer.
Okay, and where's that? Is that on the other side?
Yeah.
Could I have a quick look at that maybe?
Yeah, just around this side here. So she's meeting 30 mils an hour. You see it?
I do. And what's the urine output?
30 mils per hour.
Okay. Great, looks good. Doesn't look like there's any major issues here apart from she does look a bit uncomfortable.
Yes, I think what we'll do is try and get pain control optimised. I think otherwise her clinical signs are looking stable and she seems to be improving after her surgery.
Yeah, she looks good.
Yep.
Alright, that's great. It means that although there are no intensivists on site in Daisy Hill, it means that there will be 24/7 access to the intensivists on the Craigavon site to give advice and support on any of the patients in high dependency unit or indeed throughout the hospital. You can get a huge amount of information via the robot. You can get in real time the information from the monitor. You can see the urine in the urinometer. You can see the patient up close in high definition. You can look at all the charts and all the observations. And there's also a facility for listening to the patient's lungs and heart through a stethoscope that's on the back of the robot.
I must say, when I heard first, I had my reservations, but having seen it in action, I think it's a real benefit to the care of patients who are unstable. These patients come in and we sometimes require the assistance of intensivists, and to have one virtually at the bedside is a real bonus in terms of patient care. It's not far off having a real doctor at the bedside. I think that what we're relying a lot on is the skill and expertise and knowledge that an intensivist can offer us in the care of patients who are seriously ill. This link is a multimedia link, so the intensivist can look at the patient, can converse with us, look at information and give recommendations. And while maybe not quite as good as having an intensivist at the bedside, is the next best thing. The robot is an exciting development in the delivery of care to patients in Daisy Hill High Dependency Unit. This robot, as you can see, is mobile, can go around and conduct ward rounds with the nursing and medical staff in the high dependency unit, can interact directly with patients, converse with them, look at their clinical parameters and make decisions and give advice on whether patients need to have their treatment changed. The patients and patients' families seem to be very appreciative of having a robot because they can see the doctor who is controlling the robot, and this doctor can then conduct interviews directly, so it is like having an intensivist at your bedside. This is one of a series of developments for the delivery of high quality care for patients in the Southern Trust, particularly at the Daisy Hill site. We would look at this in conjunction with other developments as showing the Trust's commitment to enhancing the services that are available to Daisy Hill Hospital, and to continue to provide the high quality care that's necessary for an acute hospital.